Well, hello everybody. Welcome to NQA's webinar on ISO 45001-2018, the key themes, with only 2 months to go before 18001 is technically withdrawn from the marketplace. We'll just wait a couple more minutes just to see if we've got any more attendees. Right then. So welcome everybody. Just to let you know, I'm Terry Fisher of NQA. I'll go into a brief introduction in a couple of seconds. This webinar this afternoon is looking at the key themes of 45001-2018. And just as a prompt, there is only 2 months to go before the complete withdrawal of 18001. Which comes about at the end of September. So on the 30th of September, 18001 will be completely withdrawn as a registration standard. Right then, so hope everybody's sitting comfortably, then we'll begin. Just a little bit about NQA. As you can see from the slide, NQA is a global coverage across numerous sectors. We're in the top 3 in the UK for 9014, 45 and 27001. We're globally number 3 in the aerospace sector. We're China's #1 certification body for automotive. UK is number 2 for certification. America's #1 for aerospace with our colleagues at NTS. And globally, we are #1 for telecommunications in the automotive sector. So that gives you a brief overview of the global reach of NQA and the areas in which we cover. We've been established for over 30 years, and we've delivered over 50,000 certificates globally. We have all-inclusive fees, lots of employees worldwide. We're coverage in over 90 countries, and we're looking for an average customer partnership of at least 10 years and counting, which I'm glad to say we regularly achieve. As well as certification services, we also provide training, being certification and training. We cover quality, aerospace, automotive, environment, energy, health and safety, information resilience, food safety, risk management, and medical devices. We deliver a range of training courses throughout the UK, obviously covering the range of subjects that you have just discussed. And we also provide virtual learning and e-learning live webinars and etc., as well as in-house training and public training nationwide at various locations, dependent on demand. So if you have some training needs or whatever, by all means, come and talk to us. I'm your presenter. My name's Terry Fisher, as you can see there. Before being an assessor in health and safety standards and management standards, I've worked in automotive and heavy engineering, medical manufacturing, general manufacturing, wall coverings, educational estates, and transport and logistics. And so I'm more used to being sat on the client side of the table rather than being an assessor. And I think that gives you, from my point of view, gives you a good insight into how the real world works and what it's like to be assessed. So I do and can fully appreciate the traumas and the joys and trials and tribulations of having an assessment. Just to give you an overview, the webinar will be approximately 45 minutes long. If you can put questions in the chat box. We'll also have a Q&A at the end of the presentation. Presentation slides themselves will be circulated to all of you who have registered as participants, and there'll also be a recording of the webinar which will be circulated shortly afterwards. So that's an overview of where it's going from here. So in terms of what you will learn, we'll look at the structure of the standard and Annex SL and the framework, the key concepts and benefits of ISO 45001, including the potential for integration with other management standards, the importance and role of a gap analysis from OHSAS 18001 migration to 45001 for clients migrating from one standard to another, and also doing gap analysis for those who are just starting directly out into ISO 45001. We'll look at some practical guidance for the more complex clauses within the standard. We'll look at how to provide evidence and various things and addressing worker participation and how it can be demonstrated, as well as answering your questions and themes from previous webinars. So basically, throughout 2020 and before, NQA have run a series of webinars related to the migration from 18001 to 45, and these resulted in a host of questions, as you can imagine. In this particular webinar, we've used previous webinars, most recently the one from April 2021, and used some questions from that to give us some topics for discussion throughout this webinar. Just to clarify, for those of you who are in any doubt, 18001 will cease to be a recognisable certified standard as from the 30th of September 2021. So from that point, 18001-2007 will no longer exist as a registration scheme, and certificates will not be valid. To maintain a registered conformity to a OHS system, therefore, you must migrate to ISO 45001-2018. Hope that's quite simple and straightforward. So what are we looking to achieve with 45001? Well, we're looking to demonstrate risk-based thinking and a culture change within organisations, or an enhancement of existing culture where you've already got quite a strong culture. And when we talk about culture, we're talking about obviously occupational health and safety culture in terms of being proactive with risk-based thinking and worker engagement built into the integrity of the system. We're looking for it to be proactive in terms of risk management. We want a systematic approach, so it's not overly reliant on individuals' knowledge and understanding. The system should help deliver the requirements of the organisation as well as the individuals within it. We're looking at reduced culpability and reduction of risk, and therefore we're looking at protecting people and workers. Not that workers aren't people, but both people in terms of people that may be affected by the occupational activity and the workers involved directly or indirectly in that activity. 45001 helps demonstrate leadership. It can deliver actions and improvements and can be a demonstrated commitment that can be used externally to give confidence to clients and potential employees, etc. So it can say a lot about an organisation in terms of its culture and its commitment. In terms of the structure of ISO 45001, it's based on Annex SL, and the auditable clauses within Annex SL. So from clause 4 to clause 10, they're the bits that we can audit. And those of you are probably be familiar with these if you've got other management standards as well as 45. Then in terms of context of the organisation, leadership, planning, support, operation, performance evaluation, and last but not least, improvement. So your questions on 45001 as we discovered in our April webinar. So some of the themes. So basically we were asked about 45,003. So I thought I would answer that. And although it's quite a brief overview, 45,003 is a guidance standard which has recently been published in June 2021. And it's a guidance standard to be used in conjunction with ISO 45001. So 45003 is not a replacement for 45001. It's a supplementary guidance standard that focuses on the management on the psychological health and safety at work. It's guidance or guidelines for managing psychosocial risks. So that's basically, technically, its title. It contains examples and general information for organizations to supplement their 45001 management system, looking at specifically psychological and psychosocial risks within the organization. 45003 cannot be used for certification. It does, however, follow the similar structure of 45001 and is designed to be adopted as part of 45001. So the Annex SL structure is demonstrated within 45003. Over the coming weeks, NQA are developing support and information, and we will no doubt have webinars, etc., to support clients in the coming weeks. Not as yet, but there are lots of plans out there and lots of things that we're working on in the background. So rest assured, we will be delivering support for our clients in relation to 45003. That is a very brief overview of what the standard is guideline standard is about. Obviously, I'm not going to go into great levels of detail as yet, but it should just give you a flavour of what it's there for and what the standard is trying to achieve. The other question that we've received, or various questions that we've received, if anybody's got any additional questions, by the way, don't forget to fill in the chat box as we go. Like I say, I'll either try and answer those in the Q&A session at the end, or we can try and answer them as we go, depending on how appropriate they are, etc. We might save them up if they're all of a particular theme, but don't be frightened of typing in your question as we go, because it helps with the flow of the webinar. And rather than me just talking about what I think you need to hear, we're taking information directly from yourself. So by all means, participate as we go, and that makes for a more engaging and more entertaining webinar for everyone. So one of the questions that we received back in April, where does the standard state that internal audit training is a requirement? In answer to that, the standard does not specifically state that internal audit training is a requirement. It does, however, in section 7.2 require organisations to determine the necessary competence and take action to acquire and maintain that the necessary competence. So whether you interpret that as training or whether you interpret that as development, etc., generally speaking, internal auditors will require some support and some commitment. Even if they're experienced, they may be able to then help others engage in the internal audit process, etc. Or if they've had no experience whatsoever, you may feel that an external course or competence requirement is the best way to acquire and maintain that necessary competence. The main thing is it's about getting the right people to look at the internal audit processes and define their requirements within that as they go. The next question, where are internal audits set out as a defined requirement? In simple terms, that's in section 9.2 under internal audits of the management standard of 45001. Next question, internal audits, what needs to be demonstrated? Internal audits are there to provide and ensure that the system and operations are delivering the intended benefit and outcome as required within the management system. That definition could be applicable to any of the management standards, 9014, 45, etc. So an internal audit requirement is a common structure of Annex SL, and it's part of the Check Act process within that. Some of the next questions are in relation to gap analysis. Do you need to provide evidence for a gap analysis, or is it okay to answer yes or no? Well, firstly, I would say to get maximum value from a gap analysis, evidence is best, but this can also be confirmed through discussion and confirmation. And I think it all depends on who's undertaking the gap analysis, whether it be internally or external, etc. So that can change the dynamic. Obviously, somebody internal may have an understanding of the processes, whereas an external person may not. So they may ask more pertinent questions of why do you do things that way, etc., etc. And both processes, in terms of a gap analysis, are equally credible. There can be great advantage in doing internal gap analysis, and there can be great advantage in doing external gap analysis. The gap analysis is there, as the name suggests, is to find any potential areas of improvements or any gaps in between where you are and where you want to be. That's primarily what the gap analysis is there to undertake. This was the question, and I've deliberately taken the question as it was stated there. So just to reiterate, the gap analysis is just a checklist and not required to supporting evidence until the actual audit. The answer is no. The gap analysis is there to aid the organisation in its development of its system towards a given point, and I'm assuming that given point is the external verification assessment. So it's there to aid that development of that system within the organisation. And gap analysis can be undertaken numerous times. It isn't just a one-off thing, although a gap analysis template is there as a supporting document. You can use that as a tool. The benefit from the gap analysis activity, however, is undertaking it and is trying to confirm that delivery arrangements are being delivered appropriately and effectively, and therefore evidence would generally be used within a gap analysis, both internally and if conducted by an external party. The gap analysis should confirm arrangements and don't make assumptions because you know the organisation that you assume that you know something's in place and you know it's working. The whole point of a gap analysis is to reinforce that we're ensuring that it is working, because there may be elements or weaknesses within that may benefit from enhancement. So my advice would be to treat the gap analysis like an external assessment. It can be repeated internally, either in its entirety or just the areas of development if they've been identified. Use it as a tool, and it's about aiding the implementation of the system. It's trying to make it focused and look at where there are potential areas for improvement. So by all means, take it in the spirit it was intended, shall we say. The management system and performance. Question was, is 45,001 purely about worker and staff health and safety? Or is there any clause about protecting third parties? No, it's not purely about workers, although they are the core interested party in terms of that. The management standard is also looking at and includes persons who can be affected by the occupational activity, which could include members of the public or whatever. So it's about the whole of the occupational activity and who can be affected by it, and being proactive in its approach. That's the key thing. So, you know, we shouldn't wait till consider members of the public. We shouldn't wait till we injure one of them before we make that consideration. It should be there as a proactive assessment prior to implementing controls and giving protection to the members of the public. Don't wait to injure one of them, etc. So the whole management system is proactive in its approach for all levels of workers and people that can be affected by occupational activity. Another question was, can performance be evaluated without the use of internal audits? The answer, most certainly. Examples can include accident and hazard reporting. That's a performance evaluation process. Absence information and analysis. Obviously, an evaluation process that can be undertaken without an internal audit activity. Occupational health assessments, performance reports, equipment inspection reports, worker participation information and meeting minutes are all indicators and can be used as a method of evaluating performance, as indicators there too. So there's a whole remit, most of the management system data and information can be used and is intended to be used to help drive forward improvement, and therefore it's by definition it's performance evaluation information. So the organisation will generate a vast array of information, both in terms of occupational health and safety, but it could be, you know, production output. It could be environmental considerations in terms of, well, we've had a survey done and there's a discharge of this or that, and all of those can influence the occupational health and safety management system. So the whole organisation and the information that it generates can and could be used in relation to occupational health and safety. So we don't want to silo information in terms of, oh, that's nothing to do with anything else, that's just this. You know, if somebody's output performance in a production role, shall we say, declines or rapidly increases over a period of time, that could be an indication that something needs investigating as to understanding the reasons why. It could be perceived very positive in terms of production output. It actually could be an indicator of something quite negative in terms of the well-being of that individual maybe. However, you need to use all the information that the organisation's got in relation to looking at performance. So don't think that reviewing the management performance in the management system is purely about, oh, it's only about occupational health and safety direct information. There's a myriad of information that's being generated by management systems and by the organisation that can be used as indicators and performance indicators, and should be used. That's the point of the information, and that's the point of the management systems, to bring these things to, in a sequential way, look at that and review it and think, ooh, is that a positive thing? Is it a negative thing? Is it an indicator that things are improving? Is it an indicator that things are in decline? So it isn't always about the sort of direct information that you would naturally look at in terms of accidents and hazards, etc. It's also conversations, it's also people's behaviour. All these things are indicators, and we observe that in the human round throughout our days with our colleagues at work. So don't be frightened of using that information as appropriate, and as appropriate, keeping it confidential. It's not about openly discussing various things or whatever in terms of this or that. It's about you need to respect that individual, especially if you're given information from an individual, then that should be used respectfully and appropriately, and not to be just general chitter-chatter in canteens or restrooms, etc. It should be discussed appropriately with individuals that need to be included, with the authorization of the individual who's give you that information in the first point. So an important key element of integrity of management systems is having the integrity of confidentiality and trust of the individuals who work within an organization. It can be a big influencer in terms of engagement and confidence and communication when things are discussed inappropriately or displayed inappropriately, or names are mentioned, etc., out of context or disclosed unnecessarily. So it's one thing looking at data, but you must remember about people's individual personal information, which may not be appropriate to disclose openly in various forums. So always respect the individual that's give you the information, always respect that information itself, and always protect that information from accidental disclosure or whatever. Some things do not need to be disclosed in terms of individuals' personal information and general company performance activities. So excuse me a minute, I just seem to have a So that was the end of the sort of questions that we received from the April webinar. I'm just looking through now, see if we can get any good questions and important questions from you as an audience here today. So I'm just having a quick read through, see if there's anything there. I'm struggling to be able to see the questions, unfortunately. Just a second. Can't seem to open up the questions in terms of Someone's asked a question here about different types of effective worker participation methods. This can be many and varied. So sort of effective worker participation could be, you know, the number of hazard reports that are being received, or number of suggestions that are being received and acted upon. That's a good indicator of worker participation. Other types of evidence that can be used is simply recording participation in activities, and including those activities risk assessments, incident and accident investigations. So make records of who participated in participation methods and all those things. So if you keep records of who and what their job title was, is quite useful, so that anybody from outside the organisation, such as assessors or, you know, enforcement agencies, anybody looking at that can see, oh, it wasn't just done by a manager or whatever, it was done by the people that actually operate the plant and the equipment or the process or undertake the activity. So it's important to record that in the documentation that we provide for those risk assessments, for those hazard reports, etc. And those investigation activities. How did that happen? Why did that go wrong, etc. Or reviewing activities of say, systems of work, SOPs. Include workers in all these activities and document the fact where appropriate. It could be, you know, the crew of a particular plant or shift participated in that, and rather than naming individuals, say it was shift A of, you know, such and such an operation. So that's a very good indicator to us about worker participation. And like I say, there's a lot of, the more involvement and records you can capture demonstrating that, the more confident we are as external assessors that people are engaged. In terms of what we will look at when we go into assess worker participation, we will actually directly talk to workers and ask them, are you involved in this? Did you get involved in that? Or do they take notice of any suggestions that you make, etc., etc.? So there will be direct conversations with workers as we do assessments, as well as the records and the evidence in terms of documentation or whatever. So it's really important to keep good records of who participated in what, and obviously meeting minutes and discussion points, not just management meetings, but, you know, team briefings, etc. Questions asked at team briefings, questions asked at toolbox talks and updates and various presentations that may be given by the organisation to aid communication. And also disclosure of information that may come from outside the organisation. So if there has been any sort of visitation from an enforcement authority or whatever, then openly displaying that information and saying, you know, there was a visit, this was the reasons why there was a visit, and this is the outcome from that visit, etc. And displaying that information openly within the organisation appropriately is also a good way of demonstrating worker engagement and participation. So there's a whole raft of things there that can be used effectively to help demonstrate that, as well as the direct chatting to individual workers. My apologies, I'm still struggling to see the questions, unfortunately. One of the questions here from Anthony, can you discuss the requirements of safety committees within the standard? Safety committees, health and safety committees, they go under a number of guises, are an official sort of planned activity undertaken within organisations to allow participation and engagement of workers, and to give them a formal route of representation within the organisation. Safety committees are there both to recognise official representation, and that could be from a trade union or an appointed employee or worker representative, but it could also involve people from other outside the organisation. It could involve contractors, etc. So health and safety committees and formal sort of meetings of that nature can be very useful and effective in gathering the right people around to participate at the right time in the right place, so to speak. And it isn't just necessarily internal. You can invite suppliers and external providers, etc., to all of these, because in some organisations, the majority of work could be done by external providers rather than direct employees or direct staff. So it could be very worthwhile to have those sorts of engagement activities undertaken with the variety of different people. Hopefully that's answered that one. Next question, how can we integrate ISO 45001 and ISO 17025? 17025 is a standard which I personally don't assess or audit to, but I am aware of it. And it's basically those processes and those procedures that are prescribed in 17025. It's making sure in the same way that people are aware of the risks and the hazards and the opportunities for improvement, rather than just saying you must do this because it's a requirement of 17025. I would say, you know, where you've got safe systems of work or standard operating procedures that relate to 17025 and say we must do it this way because that's the controlled method, you also use 45001 in terms of and what are the hazards and risks and what are the opportunities for improvement in doing it in that way, and also the engagement of workers and others to ensure that actually, can we achieve this by a different method? Can we achieve this by doing a different way? Because if it's no good having an effective process that delivers the service requirement if it injures staff and workers within that activity. And that's where I would say you're looking at the integration of 45001 into 17025 in terms of safe systems of work or standard operating procedures, whatever the term may be. So it's that platform about an integrated management system within the organization, knowing that you've got to achieve specific technical elements, but doing that in a safe and constructive way is where I would say 45001 and 17025 would meet together. Another question here. Can we organise a session for top management? Would it be very easy and important to get? Yeah. At the end of the day, top management have a critical role to play in all management standards, not just 45001. And we need this to be owned by the whole of the organisation. So from top management throughout all levels of the organisation needs to have participate in and have some input in to all the management standards, not just 45001. But it does require commitment, because it does require their time, their commitment. It's not just about writing the odd policy and then saying, oh, well, just get on with it. It's about, right, how are we going to deliver that? And effective health and safety management will only come when that commitment is both embodied by the leadership and implemented by that leadership. They've got to not only provide resources, but they've got to provide commitment. And that includes individual commitment to engage with people at all levels, to provide resources, to provide that training, that commitment, that time, and to be open to suggestions and the cultural openness to be able to say, where can we get better? Has anybody got any ideas? And that process is really a very important element of top management and the effective implementation of an occupational health and safety system. So without top management, we will really commitment from them. And like I say, that's more than just signing a policy document. They do have to actually demonstrate that commitment in terms of how the business operates or how the organization operates. I'm just looking through the questions that have been asked. I've done the safety committee one. Hopefully I've answered some on the top management. If you feel top management is a particular weakness or you think it would be useful for a future session, by all means, send me an email. My email is terry.fisher@nqa.com. And obviously, if there is a demand there for requirements and various things, we'll consider that. And where we can, we'll if the demand is sufficient, we'll try and either include it in other webinars or do a particular series of information related to particular topics. So, looked at the 17025. Question here about what other standards or what other ISO standards are connected to ISO 45001. I would say certainly all the management standards are connected to 45001 because they're all management system standards and they should be collectively viewed as business management systems. So they should be viewed in the terms of, from 9001, it's not just, oh, we've got to make this product or deliver this service. We've got to deliver this service, make this product in a safe way that enables us to comply with legal requirements in whatever part of the globe you're in, but also to protect the organization's potential biggest asset, which is generally the workforce itself. So it's really about protecting the workforce within an organization, as well as doing whatever that organization's commercially bound to do. So it's about integrating occupational health and safety within the organization, not just, oh, we produce some widgets or we provide this service, oh, and we better consider some health and safety. It's about building health and safety as an integral part of how a company operates or how an organization operates. Hopefully that may have answered that one. So they shouldn't be seen in isolation, shouldn't the management standards? They should be seen as business management systems that are designed to be integrated and designed to be operated with integrity throughout to deliver what the organization needs to do in a safe and an effective manner. And just seeing if there's any more new questions being asked. No, I think we've looked at all of those. Unless anybody's got any burning issues, if they've got any new issues that want to be discussed or whatever, by all means, type them in now, because it's a good time for us to look at any issues that you need coverage for. Got a question here. If a company is certified to 9001, then as far as ISO 45001 is concerned, the context of the organisation and scope will be the same. Is that correct? It may be the same, but there can be subtle differences. In terms of the interested parties and the context, there may be different things in relation to the context for ISO 45001. But it should be an enhancement to your existing ISO 9001 if it's the 2000, obviously assuming it's the 2015 version that we're talking about. So the ISO 45001 could be an enhancement to an existing process. Some organizations like to do it as an enhancement. Some organizations, certainly in the earlier days, prefer to keep it separate, because it can get a little bit confusing. It depends on your organization and your understanding and various things. But generally speaking, the principles of context within 9001 and interested parties and scope are very similar to 45001, but there can be some subtle differences to who that would include, because obviously 45001 is looking at occupational health and safety and includes workers and people that may be affected by the work activity as a core interested party, which isn't necessarily the same with 9000. So hopefully that's answered that one. Just quick scroll through again. Which is the best institution to get certified as an auditor? I'm not allowed to answer that, basically because any UCAS accredited provider should be giving the same reassurance in terms of certification. So as far as I would say, here in the UK, it would be any UCAS accredited provider should be given the same level of certification service. And as far as auditor training goes, then that again look at the verification processes and the accreditations that training gives, appropriate to your geographical location and your national accreditation body. Basically, that's what I would say. Really, there's no single answer to that. So, anything new? I can't see really anything new there now. Just scrolling through. No, there doesn't appear to be anything new. So if that's basically the end of the questions, I'll go into a couple more slides in terms of service provision that NQA provide. And so just to bring us back to that. So in terms of NQA and the resources that we provide, obviously, as discussed earlier, we provide training services over multiple disciplines, over a range of subject matter, in a range of venues, and to some extent we can basically meet individual requirements where it's feasible and economic to do so. We also provide regular health and safety news and legislative updates via blogs and our In Touch magazine, which goes out on a regular basis. So if those of you who haven't signed up to In Touch and want to receive regular updates covering not just OHSAS, but all other certification type issues, by all means, sign up to In Touch, which is our regular e-magazine that goes out. For our clients, we've got various things and supporting information on our website, including implementation guides, migration gap analysis. So those of you who are migrating from 18,001 to 45,001, there is a migration gap analysis guide that is a requirement to be completed prior to the initial migration assessment, and that's to demonstrate that you've captured the additional requirements of 45,001 in terms of context and leadership, etc., and interested parties and the various changes within the structure. And for those, like I say, who are migrating from 18 to 45, there is a technical requirement for additional time to be added of the assessment process, and that isn't because of NQA just wanting an additional day or whatever out of clients. It's a UCAS and IAF requirement, so it's an international accreditation forum requirement that additional time be added to the existing 18,001 time allocation to enable those additional things to be covered within the scope of certification. So the initial migration visit will be longer than your previous 18,001 visit. We also have an NQA Associate Partner Program, which consultants, etc., are welcome to register to throughout. So there's a lot of supporting information there on our website. We try and provide a lot of support to our clients. I'm very proud of what we do as an organisation to support clients. And if you've got any suggestions for improvement, as I say, by all means, either contact me directly or contact NQA, and we'll be happy to help with any inquiries that you've got. So we're also doing a load of advanced training courses, both in terms of leadership within ISO. So that was one of the themes that someone mentioned. We're looking at, these are basically half-day courses. Leadership in ISO, effective management of change, managing your supply chain relationships, effective evaluation of compliance, how to identify risks and opportunities. That isn't OHS risks and opportunities, that's looking at commercial risks and opportunities, looking at participation and consultation of workers, demonstration of customer satisfaction, managing information security, GDPR and how to think like a data protection officer, operational resilience planning, risk process-based auditing, and effective root cause analysis, which can be applied to all sorts of standards, not just 45,001. So your final chance to submit any lasting burning issues via the chat or whatever. I'm just having a quick look through. And just to restate what we said at the start there, we will be providing a recording of this webinar and also the presentation slides. So for all those that are registered, we'll be receiving the link to the recording and the presentation slides, giving the full coverage of what we've gone through today. One quick question has come in. What are the common objectives for 45,001? Difficult to know what you mean there. The common objectives for the standard management system are delivery of policy obligations and legal compliance with enhanced performance and prevention of injury and ill health to workers are what the standard looks at. There are no standard objectives within 45,001 other than those of the management system per se, and it's down to the organisation to identify their own objective requirements, because objectives are a requirement of the management system standard and they help deliver continual improvement over time from the management standard. So it's important to distinguish those two things. Right then, so from my point of view, it's been a useful time spent with you all this afternoon, and thank you very much for your participation. Thank you very much for all your questions and stuff. It's better for you to give me information and questions rather than me trying to mind read what you need or whatever. So it's good to have that participation. And thank you all for supporting NQA, and hopefully you found it useful. If you have got any questions or whatever, don't hesitate to get in touch. It's been very useful. Thank you all very much. Keep safe and enjoy your implementation of 45001. Thank you then. Bye.